Welcome to Docner. Today, we are breaking down an important medico-legal topic, who should take consent. Let's get started. The responsibility of obtaining an informed consent falls on the treating physician. If it's a surgical procedure, the consent must be taken by a member of the surgical team who is capable of performing the surgery. This ensures that the person taking the consent has adequate knowledge to explain the procedure and address any question from the patient or their relatives. Ideally, a senior doctor should take the consent. However, for routine procedure, a junior doctor may take the consent, but only if the senior doctor is satisfied that the junior has the necessary skill and experience to take a valid consent. Anesthesiologist must obtain separate consent for anesthesia or any related procedures that the anesthesiologist will perform. Other healthcare professionals such as nurses, physiotherapists, etc. must take consent only for the procedures that they are going to perform within their scope of practice. Let's make it clear here that it is not the duty of the hospital administration or the referring doctor, or in such cases even the nurses or the physician assistant or the technicians, to take consent for a procedure or a treatment that a physician or a surgeon is performing. They might have a supportive role, but the legal and ethical responsibility is with the treating physician and the surgeon. Now, what happens when one team examines the patient but another team performs the surgery? The team performing the surgery is responsible for ensuring a valid consent is obtained. If an admitting doctor delegates the procedure to another doctor, the legal responsibility will vary based on the nature and the seriousness of the treatment. In emergencies, the admitting doctor can take consent if necessary, but again, ultimately, it remains the treating doctor's responsibility to ensure that the patient is properly informed and a valid consent is obtained. Also remember, any healthcare worker has an ethical responsibility to report any discrepancies between what the patient understands and the consent that they have given. To sum it up, obtaining a valid consent is a legal and ethical duty of the treating physician. It ensures transparency, patient's autonomy, and protection for both patient and the doctors. Remember the great words of Albert Einstein: if you can't explain it simply, you don't understand it well. If you find this video helpful, make sure to like, share, and subscribe for more such content. Got a question? Drop them in the comment box. Until next time, stay informed, stay empowered.